hope you're doing good. So unfortunately, because of some network problem, I'm not able to send you a link. So that's why I'm just evaluating it and recording it so that you can have a look once I'll be uploading it on YouTube. Okay, let's just evaluate your letter. So there, okay, Dr. G Stark, surgeon. This is fine. Okay, this information is accurate. Date is fine. Dear Dr. Stark is fine. James Smith, this is fine. The important thing here is that you don't need to mention the name of the mother. Okay, it doesn't matter whether the child is about 5 days or even a 5 hour old. You don't need to mention about the mother if you're referring the child. If you're referring the mother, obviously then you'll refer then you'll write the name. So the center of attraction should be the person whom you are referring, so only the referral would be written over here. Okay, so now you're giving me information that you are sending mother and and a son for double lung transplant. I mean, why the mother needs it? See, doesn't matter. Completely wrong. Okay. I'm right, and now let's just evaluate your purpose. So I'm writing to update you regarding James. Not only James, it should be James's condition. Okay, so there should be apostrophe. Okay, James's condition. Okay, James's condition, who has been treated for various lung infections and is now ready, not for, ready to be discharged. Okay, to be discharged into your care. To be would be preferred rather than for. Okay, into your for further assessment and management, including his suitability for double lung transplant. I understand you can mention this, but rather than adding comma, you can just add a full stop over here, and then you can mention the word, your further assessment and management, including his possibility of double lung transplant, would be appreciated. So that's how you're going to write. Okay, I hope I'm making sense. So that's the actual way of writing this purpose, because now see, this is looking much better rather than writing the way you have written. Okay. On this day, James was admitted because he reported severe shortness of breath, hypoxia, and cough, along with fever and facial pain. On examination, his blood pressure was this, okay, and with oxygen saturation of 80%, and there were bilateral crackles and wheezes. It can't be wheezes, it's wheeze. On chest auscultation. Also, apart from this, his breathing rate was increased and there was erythema of throat and tongue. Therefore, he was prescribed ampicillin sulbactam. See, ampicillin is a generic name, so it should be written with the smaller letters. And supplemental oxygen, finely written, except these few of the mistakes that I have highlighted. On this date, James was much relieved. However, his chest X-ray revealed pleural effusion and pneumonia, while his CT scan, his T should be capital confirmed chronic sinusitis. As a result, he was treated with azithromycin and ciprofloxacin 500 mg. Fine, no problem. Today, on this date, James's condition. Okay, James, again there should be some apostrophe. James's condition was clinically stable and his antibiotics regime has been completed. Fine. No, the problem here is now you're writing present in the past. I told you how to do that. Okay, if you want to write present, then write this way: is clinically stable. Therefore, his discharge plan, its plan, obviously it should be a typing error, included, not included, includes, because you're writing in the present. Physiotherapy and a modified diet plan from a dietitian, along with advice on some schooling and frequent hospital visits. Very well written, no problem. James is a high school student and his past medical history is significant for focal epilepsy, chronic sinusitis. Chronic sinusitis only. There is no need to write infection. If I am a doctor, I will eventually understand what is chronic sinusitis, right? And cystic fibrosis. Please note that his BMI is 28.5. Okay, James, rather than writing James, just simply write his family history. Okay, or write James's family history. Is positive for rhinitis and he takes phenytoin, Panadol, Rapid, Pulmozyme and Cryon. Okay, fine, no problem. In view of the above, I would be grateful if you could further assess and manage James's condition. Again, there should be an apostrophe, an S. Okay. Accordingly, should there be any queries, please feel free to contact me. Yours, there should be no comma in yours. Sincerely, now there should be a comma. Doctor. Okay, so that's how you're going to write it down. Overall, if you ask me, this is finely written letter, except this one thing of the mother that you have mentioned. Okay, so I'm just eradicating it so that you can learn. Okay, so this is your letter. This is how you're going to write it down. I have whatever the errors that you have made, I have eradicated them, so now you can read it once and then things, I hope, will make sense to you. Okay, and if you have again any problem, I'm here to answer. Thank you so much.